The day begins early for the surgeons at the University of Kansas Hospital, as it does for many people. But their jobs are very different. A surgeon's business is saving lives, finding new ways to care for patients, and restoring hope for the future. Every day, the University of Kansas hospital surgeons operate on more than 100 patients because more and more people know their best option is the specialized care of these dedicated professionals.
We have specialized surgeons who are doing the same procedures or difficult procedures over and over. Mastectomy may not seem like a difficult operation, but if you're not careful, if you don't take your time, if you don't know what you're seeing or do it too quickly, you can end up leaving breast behind. Doing the same operations over and over makes one much better at doing it well.
And the outcomes at the University of Kansas Hospital prove it. Another factor that leads to good outcomes is the collaboration that happens formally and informally among experts.
I go right around the corner to talk with my medical oncology colleague that is taking care of just breast cancer patients and vice versa. And we have breast cancer conference weekly where we present difficult patients to get the opinions of the surgeon, medical oncologist, radiation oncologist, radiologist, and come up with what may be the best plan for a particular patient that has an unusual or difficult situation.
Whenever you go to get any disease treated, you want to go to a place that sees a lot of it. We probably see the majority of the unusual malignancies that we have in Kansas, and probably in the greater Kansas City area certainly as well. They range from things like sarcomas, which there are only 10,000 sarcoma cases in the United States, total melanomas, which are relatively rare, and also when you have advanced colon cancer that many surgeons don't feel like they can remove, patients come here for those type of treatments. The surgeons and the other physicians here are familiar with complex cancers and would be able to recognize things that other places that don't see these things as often would not be able to recognize.
Ultimately, success is in the hands of the surgeon, and ours are some of the best.
We've developed a series of different therapies that allow us to treat many of the liver cancers as aggressively as possible. For instance, many of the metastatic lesions, if we cannot resect them, we have developed techniques where we block the vein on one side of the liver and push the other side, the healthy side, to get bigger so that we can safely remove the part of the liver where the cancer is.
From the best doctors, nurses, and support staff to advanced technologies to the best ratio of caregivers to patients, this hospital demonstrates where its focus lies, on the patient.
It starts from the beginning. We see them in our clinic and we take good care of them. We may send them down to the anesthesiologist and the pre-anesthesia clinic, and then the care that they receive in the operating room and after the operating room is exemplary. And patients respond and they tell me how well their families have been treated.
The staff here really have a passion for what they do. They're here because they want to be here, and they're dedicated to surgery, to providing the best patient care that they can, and they work hard every day.
On any given day, I can walk through the hospital lobby or the outpatient setting, and I see some of those patients, and I had a couple people hug and cry and just thank me and thank the rest of the team who wanted me to pass messages on to everyone that cared for them, and that they really felt like this was a special place.
As one day ends, another begins, with expert surgeons performing complex procedures. Another typical day in surgery at the University of Kansas Hospital.